There was some mild diffuse hepatic steatosis, so just fatty liver.
Holy shit. What? I first heard about this on an all-in podcast, right? A podcast of a few Silicon Valley VCs entrepreneurs. And they talked about how they did these full body scans early on to rule out early stage onset of cancers and growth. And some of the people on the podcast, right, may or may not be billionaires, like Summaup, for example. And that's kind of how I went down this rabbit hole of full body scans. And we're going to kind of go through mine today, right, and see kind of if I'm in trouble. But there's a really neat article by a physician that was a little skeptical of the concept of full body scans. So whole body imaging scans as a cancer screening tool are low yield in healthy patients with insignificant medical history. If you're a physician reading this isn't news to you. But if you're not a physician, don't be fooled. The benefits of these whole body scans don't outweigh the risks, which include unnecessary physical, emotional, and financial harm.
This individual is obviously a well-read MD, and he has a point of view shared by a lot of conventional physicians, and he does make some good points.
I remember reading about Michael Milken and Steve Ross, who was the founder of Time Warner. Both of them ate hot dogs like every day, and they had prostate cancer. Unfortunately, Steve Ross died from it. Milken was able to treat it, but it's like, if you could get that diagnosis way earlier, how much is that going to be worth to you? And so they talk about, like, I guess the false positive rate with high variability.
I do think that is true. There are incidental findings in some false positives that can occur, but the reality is you can get incidental findings and false positives on any scan.
But some people, to his point, don't want to know, right? And being the bearer of bad news, it's probably not not the most positive role to play. I've blown out my knee 4 times, right? And so I actually just decided, to go through with this.
What is the value to a particular patient knowing that they caught a particular cancer early? I mean, what's an extra 10 or 20 years worth of life worth to you, right? And it's really at this point, I think, targeting a different sector of the population
that has a willingness to pay and an ability to pay.
And they're not mandated by any means, right? So if you're interested, do it. If you're not, you don't have to.
All right, Dr. Ryan. So I'm kind of nervous here. So you ready to go through the scan? So
yeah.
All right, let's do this. Dr. Ryan, I think they have an error. I'm actually 6'2" in shoes.
Oh, 6'2" in shoes. Yeah. Okay.
I got that wrong.
All right.
All right. So that's the first error. Okay, let's go.
Okay. So they already put a disclaimer where they basically say this is really just an adjunct and not intended to replace other screening practices. So in other words, this is just completely a screening procedure, and it will just give you some more information. But again, if something does turn out to be positive, additional screening and imaging is probably indicated, right?
It can't be used to diagnose then? Is that what you're saying?
I don't know if it could necessarily be used to diagnose, particularly if there wasn't like clinical symptoms there. It can start a discussion. That's the best way to look at it, I think. And so it said, overall, other than a benign congenital cystic appearance in the posterior fossa, the white matter signal in the brain is normal. And so the fact that this cystic appearance in your posterior fossa, the rear of your skull, is benign, it's not really anything to be concerned about. There weren't any solid masses, no collections, no issues in terms of your blood vessels. You did have a nasal septal deviation. I believe you had disclosed to me that you'd had surgery for your deviated septum.
I've had 3 surgeries. It's so weird.
There's still like some mild deviation after surgical correction. There's no masses in your thorax, abdomen, or pelvis, and no enlarged lymph node. That's a good thing. There was some mild diffuse hepatic steatosis, so just fatty liver.
Holy shit. What?
But again, it's mild, and I would just say that it's maybe the first signs we got to clean up the diet a little bit. Around the time of this, you were frequenting in and out a little bit too much. So
yeah,
that would be something that I probably would maybe hold off on. You did talk about how you had an ACL tear in your right knee. That's
4 surgeries.
evident there, yeah. And then some mild degenerative changes, and this is really common in a lot of individuals in the general population. What's interesting is degenerative changes in your spine, particularly in your lumbar spine, don't necessarily correlate with back pain, right? I always look at their symptoms on physical exam and see what their symptoms are before I make any changes in regards to this. And then it said your soft tissues were unremarkable. Now, they did recommend the follow-up scan in 12 months. I don't know if that's totally necessary. I think this is just kind of useful in that you have a baseline. And for otherwise healthy individuals, it's probably going to be something like this.
Well, Dr. Ryan, I think that was pretty helpful because I can't tell you how many times my wife was Googling like the systemic neurona, and she's like, what is this? And going through and getting a little worried and stuff. And I think, Dr. Google probably isn't the best way to do it, but I'm actually, believe it or not, kind of happy. I did that, the whole fatty liver thing, which was pretty funny. Got me, just to basically start thinking more about like what I put in my system. I got a standing desk, health as well, right? And so just being able to kind of de-risk was valuable to me, but it may not be the same for others, right? But I think that was really helpful for me, and I'm happy I did it.